The next drug class is the atypical antipsychotics. These drugs are used to treat a similar spectrum of diseases as the typical antipsychotics, but they have a more favorable side effect profile and are also more effective for the negative symptoms of schizophrenia like avolition, flat affect, etc. There are 6 drugs in this class you should know: olanzapine, clozapine, quetiapine, risperidone, aripiprazole, and ziprasidone. And you can remember this using the memory aid. It's atypical for old closets to quietly whisper from A to Z. It's atypical for old closets to quietly whisper from A to Z. And that'll help you remember the atypical antipsychotics, because they don't follow a pattern like the phenothiazines, which all end in azine, like we discussed for the typical antipsychotics. Their mechanism of action includes a variety of effects on 5-HT2 receptors, serotonin receptors, dopamine, alpha, and H1 or histamine receptors. As we said a moment ago, the atypical antipsychotics are often used in schizophrenia, both for the positive and the negative symptoms, while typical antipsychotics are often used primarily for positive symptoms. The atypical can also be used for other disorders like bipolar disorder, OCD, anxiety disorder, depression, mania, and Tourette's syndrome. So while we did say that atypicals tend to be favored because they have fewer extrapyramidal side effects, they do have a few specific side effects that are worth remembering. One is that atypicals cause weight gain in patients taking either clozapine or olanzapine. Another one, and one that you'll classically see on a boards question, is that clozapine can cause agranulocytosis. So patients on this medication require weekly complete blood counts to check their WBC counts. And it may help you remember this by thinking that clozapine traps neutrophils, like the one here, in the closet. So clozapine traps granulocytes, like this neutrophil here, in the closet. And clozapine can also cause seizures. Risperidone may increase prolactin levels. And can you think of what this might cause? It's going to lead to lactation and gynecomastia. Remember that prolactin inhibits GnRH secretion, which will affect the levels of LH and FSH. And remember that LH and FSH regulate the phases of the menstrual cycle. And this will lead to irregular menstruation and fertility issues as well in women. Lastly, ziprasidone can prolong the QT interval, so it's important to watch for arrhythmias in patients taking ziprasidone. The next few slides will discuss individual drugs that are used in a relatively narrow window of diseases. The first of these is lithium. The mechanism of action is not well established, but it's thought to relate to the inhibition of the phosphoinositol cascade, which you can get a refresher on from the Pharmacology chapter. It's used as a mood stabilizer for patients with bipolar disorder because it can help to block acute manic events. It's also used for SIADH, syndrome of inappropriate ADH, because one of its side effects we'll come to in a moment helps patients with SIADH. So the side effect profile for lithium is fairly extensive, but I remember the most significant side effects with the mnemonic LMNOP. The L stands for lithium, M for movement, because it can cause movement problems like tremor. N for nephrogenic diabetes insipidus. O for hypothyroidism. And P for pregnancy problems. So let's look now at these pictures at the bottom of the screen. Now the characteristic side effect you may be tested on is that it can antagonize the effects of ADH at the kidney, causing what? Nephrogenic diabetes insipidus. And coincidentally, this also makes it a relatively effective treatment for SIADH. Patients with SIADH may have high levels of ADH secretion, but lithium will inhibit the effects of ADH at the level of the kidney, and that's why it's called nephrogenic diabetes insipidus. However, it is not commonly used for this purpose, and actually, dimeclocycline is more commonly used for SIADH. One more thing, patients taking lithium must also be careful not to become dehydrated, because lithium is reabsorbed in the proximal convoluted tubule. And it follows sodium reabsorption, so dehydrated patients will have increased lithium reabsorption, which can lead to toxicity. Now the final side effect, which we said was pregnancy problems, is that lithium can cause teratogenic effects in the fetus. And do you remember which one is most common from the cardio chapter? The classic one is Ebstein's anomaly, where the right ventricle becomes atrialized. You see this small right ventricle here. And you see the right atrium is much bigger and the valves are much lower than they normally should be. And we have a very small right ventricle. And this is all due to the downward displacement of the tricuspid valves. And this can be a teratogenic effect of lithium. The next medication is buspirone. This drug works as a serotonin 5-HT1A partial agonist. Buspirone is used to treat general anxiety disorder, and it's thought to be an effective medication in part because it doesn't cause sedation, addiction, or tolerance. And it's this facet of the drug that's usually tested and why it's usually preferred for general anxiety disorder. And the mnemonic I use to remember this is that you can't drive a bus if you're sedated. So buspirone doesn't have sedation. And unlike barbiturates and benzodiazepines, buspirone will not cross-react with alcohol, which is another positive feature of this drug. Okay, flash quiz. What blood tests do patients need if they are taking clozapine? They need periodic complete blood cell tests since clozapine can cause agranulocytosis. Remember, clozapine traps granulocytes in the closet, causing agranulocytosis.